Hey guys, my name is Hannah Boren, and today we're going to be talking about the national opioid crisis. So at the end of this lecture, I would like each person in the audience to be able to, number one, tell me what the national opioid crisis is and be able to explain it to a friend or coworker or family member. Next, I would like the learner to be able to identify examples of opioids. Knowing what medications are considered opioids are very important. 3, I would also like the audience to be able to help someone who is overdosing from opioids and know what to do in that type of situation. And then lastly, I would also like the learner to be able to identify a place in their community or a difference in their community that they can do, or a place that they can bring an abuser to be able to get help. So next, what is the national opioid crisis? This is a crisis that we are experiencing in the United States where pain medications or opioids are misused, or people are getting addicted to them, and then we have an addiction problem to where we are having to get them into rehab or prescribing them more pain medications to be able to taper them off. So who is at risk and why? Everyone is at risk to being dependent on opioids, myself included. Healthcare professionals experience a pull for this because they're around it all the time. It's very accessible to them. Even though laws have been made to prevent this from happening, it is still a temptation that healthcare professionals experience, whether you think about it or not. You yourself have been a candidate for being dependent on opioids. Think about it. If you've ever had a dental procedure, what were you sent home with to help with the pain? More than likely hydrocodone or oxycodone. Think about children who get their parents' pills or find it in their home, and then they end up being poisoned from it, and then they're taking it every now and then when they get in their teenage years. That's a situation where they could be dependent on opioids, as well as these newborns who are born to someone who is abusing drugs while they were in the womb. And then you have to deal with weaning the newborns off as well. You being in a motor vehicle accident to where you have an acute injury such as a fracture and you're treated with pain medicine, it can take one prescription to be dependent on these things, guys. How has it affected the healthcare industry? This has affected the healthcare industry in causing a financial strain on the healthcare industry. We have noticed a huge leap in 2011 to 2015 and 100% increase in opioid abuser dependencies, costing from $71.66 million to $721 million. That is, like I said, a 1,000% jump. And the big thing about this is because you think about it, you have a patient coming in who's addicted to opioids. They've lost everything in their life, more than likely. They do not have a way to pay for this. Either insurance companies are eating it or the hospital is eating the cost because they have no way of paying it back. Also, look at the newborn statistics on there, to the rise just in 1 year of newborns being admitted to the hospital and the cost that it's costing. And you think about it, guys, these parents don't have a way to pay it either, and Medicaid is eating that up, which is potentially our government paying for these poor babies to be hospitalized for longer periods of time due to them being addicted to opioids when they're born. You may ask, what is Mississippi doing to help this situation? Mississippi has come up with a prescription monitoring program. This is regulated by the Mississippi Board of Pharmacists. So pharmacists can pull it up when they see a patient bring in a prescription for opioids. They can pull this up and be like, no, I'm not going to fill this. I'm sorry, you've had this filled by, you've just gotten pills within the last 10 days from another pharmacy. I will not fill this. I know personally in my own clinic where I work, we actually use this prescription monitoring program to look at the history of a patient's pain scripts. We can look at, number one, what the patient was prescribed. Then we can look at number 2, who the prescriber was. And then number 3, what date it was filled and for how many, the quantity of it. So we can look and say, you have a fracture, but you just received pain medications a week ago. This should be able to cover you due to the quantity, etc. So this is a great thing that Mississippi is doing to help limit opioid use in Mississippi. Next, so you may be wondering what an opioid is. So an opioid can be, number 1, the illegal substance of heroin, or number 2, prescription opioids such as hydrocodone, oxycodone, oxymorphone, morphine, fentanyl, codeine. This can be found in cough syrup, guys. Codeine can be found in cough syrup. Is that not wicked? So just think about if you've ever heard this called another way, such as street names, such as like Oxy. I know some people call them Codees. I've had people in my clinic call them Happy Pills. I mean, people can come up with names for these things just right off the top of their head. So be aware of what these are, and then also the street names. Now, how can you tell if a coworker is experiencing opioid addiction? So you may notice them being more absent from work, missing work more often. You may notice a change in their personality, them being more moody, more aggressive. You may notice that they aren't treating the same symptoms in patients. They're treating them differently, such as if my doctor had a fracture coming in and we normally have a protocol for that, he'd be doing something totally off the charts that would make you send up a red flag and be like, wait a minute now, we've never done this for this type of injury. So just pay attention to those things. You'll notice a change in their diet. They're not eating as much, and some medications can cause them to have the munchies and eat more. If they're shooting up, so to speak, if they're injecting themselves, you will notice that they are wearing long sleeves more to hide that bruising, scarring, puncture wounds. Okay, signs and symptoms of someone who is overdosing from opioids. So you will notice that their pupils will be pinpoint. I mean, super small. They will be constricted. They'll be in respiratory distress, which means they have shallow breathing. They're choking. If this happens, you can lay them on their side to prevent aspiration, which we'll talk about in the next slide. You may notice that they have cyanosis, which means blue lips, because they're not getting enough oxygen. Remember, guys, this causes respiratory distress. You may notice that they're trying to fall asleep or a lack of consciousness. So the next slide is going to go over how can we help somebody who is experiencing opioid overdose. Like I said before, lay them on their side so you can prevent them from choking and aspirating. Immediately, though, first thing you need to do is call 911. This is a medical emergency. You need to also try to keep them awake and alert. And if you have naloxone or Narcan readily available, you need to administer this. Now, what is this? You may be wondering. Naloxone and Narcan are both a reversal drug that can reverse the effects of a person overdosing on opioids. Now, Narcan is the nasal spray that is readily available that you just may spray up their nostrils to prevent opioid overdose. And then number 2, naloxone is the injectable version of this medication. And what I have noticed is, I'm going to go ahead and give you guys the reference page, but what I have noticed is that a lot of communities don't have this readily available. I know personally in my own community where I have made a difference and where you can make a difference is checking with your local fire departments to make sure that this is readily available for them to have when they respond to a call and get there probably before the ambulance does. They need to have this readily available to be able to administer this to a patient. Make sure that these acute care clinics are stocked with naloxone. Because think about it, guys, if you live in a rural area like I do, a hospital is 30 minutes to an hour away. And a patient who is suffering from respiratory distress cannot wait that long. So that is something that you can do to petition in your community to have these things readily available. Raise money so that your local fire departments and acute care clinics can be able to finance this. There are also grants out there that can help you. You just have to initiate it. But this is a way that you can help in your community, is to make sure that this reversal drug is available for people who are suffering from opioid dependency and then possibly overdose.